Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and we get lots and lots of questions about PRP therapy and what is it exactly, why does it work, why is it gaining such popularity over the last several years, and so I'm going to answer those questions in this short video today. PRP therapy, it stands for platelet-rich plasma, and the best way I can describe that is there's a component in your blood and it's plasma. It's about half, it's less than half of the red blood cells, but it's close to that halfway marker. And you would know this if you ever go to, say, like a Carter blood center and you donate blood. They will ask you if you want to donate plasma instead of blood, and you can donate just the plasma. What happens is they draw your blood, and then while your blood is coming out, it goes through a machine that spins out the platelets, and then it puts the red blood cells right back into you. So you're just donating the plasma portion of your blood. So in that plasma, it's very, very loaded and concentrated with platelets. And platelets are what actually heals the body on the inside of you. So like if you got a bruise, you got bumped on your arm, and then within a day or two you had a round bruise. You know, you've seen a bruise before. That bruise is just those red blood cells that have leaked out of the artery or vein and due to damage in the capillaries, and it just sits in the tissue, and now it just gives a discolored color, kind of purple. It's the red blood cells through the skin. It makes it a purple appearance. But why does that bruise stop getting produced in a certain amount of time, and then it starts to shrink? Well, it's not producing additional bleeding into the tissue because the platelets inside those arterioles and veins are coming by when the blood is still pumping, and instead of just spilling out and spilling out and spilling out, it's packing up around that little opening, around the crack or hole or damaged to the vessel, and on the inside those platelets actually heal up that spot, and so then your body can just keep pumping blood through the arterial system and venous system, and it no longer is continuing to leak out. So those platelets are what heals that part of the body. And so the healing factor inside that platelet is the growth factor. So we actually can draw blood, get one test tube full of blood out of a patient, take that test tube to our centrifuge and spin it at a certain frequency for a certain amount of time. And then when we pull that test tube out, it's got two distinct layers in that test tube. The bottom, the heavier, is going to be the red blood cells. It's very bright, dark red down in the bottom half. The upper half of that test tube is going to be yellow or straw color, and that is the plasma. And so we then take a needle and syringe, and we stick it down in the top of that test tube, and we draw into the syringe just that part where the blood and the plasma are starting to mix. It's kind of pink right in that area on the plasma side. We draw that into a syringe, and then we can get 1, 2, even 3 millimeters worth of platelet-rich plasma out of that test tube, and then go right back into the body with it and inject areas of soft tissue damage, areas of strain type injuries, which would be any of the itises that you've heard about. So you've probably heard of tonsillitis, which is inflammation in the tonsils. Well, the musculoskeletal system in the elbow, it gets what's called lateral epicondylitis, which is like tendonitis of this flexor tendon of the wrist that attaches right in the elbow. And so they have these braces that you see athletes wear right down here. It's just creating a new insertion point for that muscle because it's pulling away from that bone right there, and it's getting inflamed. So we inject into that area 3 or 4 or 5 times. Right in the spot, we put a bunch of platelet-rich plasma, and your body quickly heals that area, and it relieves the pain. That's one area. That's epicondylitis. We can do it in plantar fasciitis, which is inflammation of the plantar fascia on the bottom side of your feet towards your heel. We can do it in bicipital tendonitis, which is pain in the shoulder joint and down the front side of the arm because this tendon that flexes our arm and lifts our shoulder, that gets inflamed. All of these are itises, right? You can do it into a bursitis. Bursitis is when the bursa of your hip, say, or shoulder gets inflamed. We've got bursa in our elbows as well. So these are all the itises. Itis just means inflammation in your body, right? So any of these inflamed soft tissue areas do really, really good when it comes to healing as a result of PRP therapy. Now, the good news about PRP therapy is 100% natural. There are no steroids mixed in. There are no medications mixed in. I mean, there is nothing mixed in except for your own platelet-rich plasma. It goes right back in your body. And so you would say, well, if I already have this in my body, you're taking it out and putting it back in. How come it's not going to heal as is? It's in my body already, right? Well, when we take it out and spin it, it concentrates it at 4 to 5 times the level that it gets when it's just mixed in with the red blood cells. So when we draw that yellow part out of that test tube and put it right back in one spot, it's like we're putting 4 to 5 times the amount of growth factors in there all at once. Also, secondly, the good news is there's no negative side effects. It's all natural. It's out of your body, into your body. It's not an allograft, which means we took it out of one person and put it in the other person. It's an autograft, which means it came out of you, the specimen, and we put it right back in you on the same visit in the office. Takes about 10 minutes to spin, so there's no growing or culturing or anything that would be considered wrong or unethical or illegal according to the FDA. PRP therapy is gaining popularity tremendously. Now, I will tell you this, it is effective at most ages, but it's way more effective if done in the younger population because their growth factors are so much at a higher level. So if you're 18, 19, 20 years old, all the way up until about 40 to 45, it's going to have a better result for you than, say, someone who's 65 or 75 years old, because their growth factors have slowed way down in production. So even though we're concentrating them, we're giving them all we can, it's not going to have the exact same results on a 65 to 75-year-old body as it would on a 15 to 45-year-old body. So that's PRP in a nutshell, platelet-rich plasma. We do it here in the office. Usually we recommend them in 3s because the more we put in there, the better it is. So we'll do one every 2 weeks. One this week, skip a week, do another one, skip a week, do another one. Sometimes we're drawing enough PRP out of the sample that we can do more than one body part. So we could say do both shoulders in one visit with the same sample. But yeah, those we do 3 of those, and if you pay for each of the 3 of those, then you get the 4th one free. So you actually could get about 8 weeks worth of this. Now, we do other things in the office as well for these types of injuries. We've got shockwave therapy. We've got stuff that I'll explain in other videos. But today I really wanted to concentrate on the PRP because that's a very common question. You can find out more information on the website at trinityintegratedmedical.com. And there's a PRP tab on there. You can just read all about it, or just Google search PRP and you'll find it. More videos of mine here on YouTube that can show you as well. But it's Dr. Tim Uselton just explaining all things PRP in today's short little education, and I hope you have a great day. Be blessed.